flush, clamp, disconnect. Okay? All right, let's do this scenario again. I have 2 saline flushes, white caps. I have the medication that I prepared. It has the needle on it. And now I'm going to give this medication through a central line. A couple things about central lines. Generally speaking, central lines are inserted into central veins. The subclavian vein up here, the jugular vein in the neck, or the femoral vein in the groin. Okay? Those central IVs, central lines we call them, the patient's central blood system is being accessed immediately upon puncturing the skin. So skin to central vein system is very quick. That poses infection risk. So we're very concerned about how we access and care for central lines. There is a peripherally inserted central catheter that can be used, and that's placed in the upper arm in one of the veins there. So that's where the vessel is accessed, and then the catheter extends on up to the right atrium. Still, infection is a main concern, because if we introduce pathogen into that central IV or a line accessing the central system, you don't have the peripheral system with its macrophages and its immune system there to gobble up that isolated bacteria that may have gotten into the system. It's going directly to the heart. Having said that, anything going into the veins, peripheral, we should be aseptic with it. Okay, but we're particularly aseptic with central lines. To that end, any time that you are accessing a central line, you'll notice when I cleaned these ports, you know, I just did a good job to clean it. When you access a peripherally inserted central line or a central line, you should scrub the hub you should scrub the hub for 30 seconds. The evidence-based research on that says that if alcohol has solid contact with ports for 15 to 30 seconds, any bacteria have been destroyed. And so we don't teach 15 seconds because when you get to be a nurse, time speeds up. And so if we teach 30 seconds, eventually 30 seconds ends up being 20 seconds. It's just the nature of the beast. So a Picc line, and Michelle and I, we created this Picc line, okay? We just got kind of ingenious. You will generally find it in the upper arm, and you will find it in the inner medial part of the upper arm. And so when the patient first gets a Picc line and they come back, they're going to have a big transparent dressing on it. And it may, if the patient was oozy in the procedure, they may have it covered with a gauze. If it's covered with a gauze and a clear dressing, you're obligated to change that within 24 hours. If they come up like this, clear, and a biopatch, then that dressing is good for 7 days, unless it becomes non-occlusive. Now, occlusive means that the wound or insertion site is completely and effectively covered. It doesn't mean that the IV is occluded. Occluded is the IV is blocked off. Occlusive is the dressing, okay? So this is a biopatch, and what it is a little disc that is impregnated with antimicrobial substance, and they put those right at the site. When you have to change this dressing, the biopatch has to be placed sterilely, the dressing has to be placed sterilely, the site has to be cleaned sterilely, you have to put on sterile gloves, you have to wear a mask, patient wears a mask. It is a sterile procedure. That's for another day. Piccs generally have 2 ports, and I said we're pretending. You wouldn't, these things with the tape, they wouldn't exist. When the Picc line is new, the cap tends to look like this. The difference between this cap and this cap is this has anti-reflux in it. This does not. The caps, by policy, you have to look at the hospital policy, but I think they're good for 3 days, might be 4, but we change these caps. When we change these caps, we end up with these. Okay, When not in use, a Picc line should be clamped. So I've introduced, my patient knows I've got the right medicine, the right patient. We've been chatting already. So I'm going to access his Picc line. And it doesn't matter which line you use. One is usually blue and one is red. Of course, one might have fluids infusing. So depending on what those fluids are, you may or may not want to use it. If there's a compatibility issue, then of course you're going to use the open port. So literally 30 seconds. 1 and 2, 3, 4, 5. And I tell you what, 30 seconds can be a while. In the clinical setting, what I do is I probably count to 50 doing this because my counting is faster. I go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50. And that pretty well gets me to 30 seconds. Actually, I'm pretty sure I was a little bit over, but that's because I started scrubbing before I started counting. Okay, so that's accessed. I'm going to take a saline. When you're dealing with a Picc, you should do flushes in 10 ml increments. Okay. Central lines, they don't need as much, but because Piccs are long, they do need more. Cap is off. Notice I'm hanging on to this and I didn't let it go. I'm going to break the seal and get the air out of there. No need to give the patient the air. Probably not a good thing. Now I unclamp. I inject my 10 mLs. I'm going to lay this down because I can. Okay, and I'm going to get my medicine. You don't have to lay it down, but you can. So the cap comes off of this. I'm going to do a sterile switch. This is an empty syringe now, so I'm just going to let it drop. I'm going to put my medicine on. I'm going to inject my medicine for the prescribed amount of time. Then I can lay it down when it's injected. I get my unused saline. Take the cap off. I do another sterile switch. And I inject that 10 mils. Do keep in mind that initially, and this is the distance from here to the patient, actually to the patient, is probably a mil. So that first ml of the final flush, you want to be considerate of the rate that you're pushing it in, because at that moment you're still giving medicine. Once you get past that first mil, you can just flush. And then you're going to clamp. Picc lines don't have these slide clamps on them, they have pushy clamps, but I think you'll be able to accommodate the difference. Clamp and then take this off. Now since I'm in here, this other port, if it didn't have fluids going, I would go ahead and I would take a clean alcohol. I would give it a 30-second scrub. Sterile 30-second scrub. Sterile 30-second scrub. I'm faking right now. Okay, sterile 30-second scrub.